Doctors deliberately infected patients with malaria and won a Nobel Prize for it. The treatment was intentional. The deaths were expected. The cure was theoretical. This was celebrated medicine. In 1917, Julius Wagner Jauregg faced an impossible disease, neurosyphilis, syphilis that had reached the brain. Patients lost their memories, then their minds, then their lives. There was no treatment, only decline, so he proposed fire. Doctors believed high fever could kill the infection. The body's own heat was weaponized. Malaria produced reliable fevers. Doctors deliberately infected the patient. They let the fever burn. Then they treated the malaria with quinine. The logic was simple. Trade one infection for another. Hope the patient survived both. Blood was drawn from malaria patients and transferred into psychiatric wards. Fevers arrived within days. Patients shook and sweated through their sheets. Doctors waited. The protocol required repeated fever cycles. Then quinine was administered. If the patient was still alive, the treatment was complete. Some patients improved. The tremors faded. The confusion lifted. They recognized their families again. Others declined later or disappeared from follow-up entirely. Doctors recorded the recoveries. The charts could not record what happened afterward. Journals published the results. The fevers came first. Improvement followed often enough. That was enough. In 1927, Wagner Jauregg received the Nobel Prize in Medicine. Hospitals across Europe and the Americas adopted the protocol. What began as desperation became standard care. Not every patient survived the fever. Some died during treatment. Others survived with no improvement at all. Their deaths were recorded as acceptable risk. Some endured the malaria and still had the syphilis. The alternative was worse. By that metric, infection was considered mercy. In the 1940s, penicillin arrived. Syphilis could be treated directly. No fever required. No malaria necessary. The infection wards closed. The blood transfers stopped. The Nobel Prize remained. No one retracted it. No one apologized. The method simply became obsolete. The doctors were not reckless. They faced a disease that destroyed the mind and used the only weapon they had. They measured outcomes. They published data. They believed they were saving lives. The infection was intentional. The outcome was not.